Good afternoon, guys. I have discussion B for you. We're discussing for this afternoon's B. We are discussing the end of the waiting room, the future of medicine in 2026. Give me 1 second to set up for the show, please. Here's a clean, grounded explanation you asked for based on the page content you're viewing on outside sources. Title, guys, is what the end of the waiting room future medicine means in context. The surrounding page content makes one thing very clear. The end of the waiting room isn't about hospitals getting faster, it's about moving care out of the building entirely. The headline signals a shift from clinic centered medicine to home first, tech supported, continuously monitored care. On your page, every section reinforces this transformation. Okay, guys, I'm going to break it all down for you. Please sit back and enjoy. First one, the waiting room disappears because the clinic visit disappears. The page repeats the core idea. Routine care, chronic disease management, and many high acute services like dialysis. Give me 1 second. Are now being delivered in the home, supported by virtual teams, remote monitoring, and AI-driven risks satisfaction. When care comes to the patient, the waiting room becomes unnecessary. 2. Remote triage replaces the come sit until we call you model. The page emphasizes virtual visits resolve many issues before anyone travels. Remote triage lets clinicians decide whether in-person visit is even needed. Continuous monitoring, wearables, home devices catches problems early so patients don't show up in crisis. This removes the bottleneck that waiting rooms were designed to manage. Real world example, dialysis at home. The page highlights a patient, Gerald Faust, who moved from center-based dialysis to in-home dialysis with virtual supports. His case is used to show it's clinically feasible, it improves outcomes, it reduces the need for repeated clinic visits. A patient who no longer travels to a dialysis center no longer sits in a waiting room. 4. Why 2026 is the turning point. The page frames 2026 as the moment when AI risk satisfaction, remote monitoring, or prayer provider partnerships. Hybrid clinical staffing models finally makes home-based care scalable, not just aspirational. This is why the headline uses a question: the end of the waiting room, to signal near future shift that is already underway. 5. But the page also warns this future isn't automatic. The surrounding content lists the trade offs: equity risks, broadband gaps, device access, digital literacy. Workforce strain. Clinicians must adapt to hybrid roles. Safety boundaries. Not every condition can be managed at home. Payment models. Reimbursement must support home-based modalities. The waiting room disappears only if systems are designed with equity and staffing in mind. 6. Bottom line, as the page itself puts it. Bringing care home can eliminate many waiting room visits when paired with remote monitoring, virtual teams, hybrid workflows, equitable access plans, sustainable payment models. The headline is pointing to this exact shift, a future where the waiting room fades because care is proactive, distributed, and home-centered. Here's a clear, grounded explanation of the headline. Skip the waiting. Skip the wait. The modern patient's guide to stress-free primary care, based directly on the page you're viewing. Core meaning. The headline signals a shift away from the old model of primary care: long waits, slow communication, and fragmented service, toward a patient-centered, time respecting system designed to reduce stress. Especially for seniors managing multiple conditions. The surrounding page frames skip the wait not as a gimmick, but as a complete redesign of how primary care is delivered. What skip the wait means in context. 1. Eliminating the waiting room. The page opens with a critique of the traditional waiting room. It's inefficient. It increases infection risk. It raises blood pressure and anxiety. White coat effect. The modern model moves patients directly into exam rooms or uses virtual visits to remove the waiting room entirely. 2. Faster access to care. The guide contrasts old 2 to 4 week appointment delays with same day or next day availability, which prevents ER overuse. Stops small issues from becoming chronic. This is a major part of stress-free care. You don't wait weeks to be seen. 3. On-site diagnostics. Reduce delays. Instead of sending patients to outside labs, the modern model integrates labs, EKGs, ultrasounds. It cuts the diagnostic delay by up to 70% and reduces the physical burden on seniors. Telemedicine as a true alternative. Telemedicine isn't presented as a backup, it's a primary tool for chronic disease management, follow ups, messaging uploads, photos, asking questions. This is the ultimate version of skip the wait, not commute, no lobby, no delays. Proactive preventative care. The page emphasizes a shift from sick care to well care, genomic and biomarker trend tracking, behavioral health screenings, early detection to avoid crises. This reduces future waiting by preventing emergencies in the first place. Six, senior focused support systems. The guide highlights the stress seniors face navigating Medicare, specialist referrals, medication lists, transportation. Modern primary care reduces this stress through case managers, integrated pharmacy services. ADA compliant transportation. This is part of the stress free promise. The system carries the burden, not the patient. 7. Communication that doesn't leave you hanging. The page repeatedly stresses direct messaging, 24/7 portal access, plain language explanations, no more waiting days for answers or feeling confused after a visit. Emotional and environmental comfort. Stress-free care also includes kindness as a clinical requirement, warm modern clinic design, social activity centers, integrated mental health supports. The headlines modern patient is someone whose emotional well being is treated as part of their medical care. On this page, skip the wait is shorthand for comprehensive redesign of primary care that removes the physical, emotional, and logistical stressors that used to define a doctor's visit. It means no waiting room, no long appointment delays, no fragmented services, no confusing communication, no unnecessary travel, no feeling like a number. Instead, the model centers speed, clarity, comfort, and proactive care, especially for older adults who need it most. Okay, guys, that is B for you. I will be back on with C shortly. Give me a bit for that, please, and I'll be back on with you.